Awesome. Hi, everyone. Thank you so much for having me. I'm so honored to be invited to speak here. Like Lynn said, I'm Christina Sarmiento. I'm a physiatrist or a rehab physician at the University of Colorado. So just a little bit more about my background so you can understand where I'm coming from. So I trained in both adult and pediatric rehab medicine as well as general pediatrics. And throughout my training, saw this huge gap in care for adults with childhood onset disabilities. And that really became my passion. And so my career goal is to improve healthcare access and outcomes for individuals with CP and other childhood onset disabilities across the lifespan. And I do that in two roles, as a clinician and a researcher. And so I'll talk just a little bit about transition in general and then about some of the specific research that we're doing through our clinics. So as many of you know, there's increasing numbers of children with medical complexity, disabilities, special health care needs, however you define it, that are living and thriving into adulthood. And so right now there's a huge range of estimates, but it's estimated that 50 to 90% of kids with disabilities reach adulthood. So what that translates into is more than 500,000 youth just in the US alone that have complex medical needs entering adulthood every year. And fewer than half are receiving appropriate transition care. And transition is a really vulnerable time. So there's decreased access to services, insurance changes, decreased treatment adherence, and this all leads to poor health outcomes and a reliance on emergency services rather than established routine medical care. And poor transitions lead to poor continuity of care, lack of age and developmentally appropriate care, poor health outcomes, secondary complications, increased risk of psychosocial difficulties, decreased community participation, increased healthcare services usage, and again, that reliance on emergency services. And so just a little bit about cerebral palsy in general. I'm probably preaching to the choir here, but as we all know, it's caused by a non-progressive injury to the developing fetal or infant brain. And the reason I bring this up again is even though because I'm saying it's a non-progressive injury, it does not mean it's unchanging. And so there's this growing emphasis on viewing CP as a lifespan condition, and there's unique risks and considerations that we need to take into consideration of the care of adults with CP. And so right now, about 80% of individuals with CP are adults. And despite this, the majority of services, interventions, funding, research studies are focused on children. So the needs of adults with CP is a research priority, and that's according to both the National Institutes of Health as well as stakeholders that include adults with CP and family members. And kind of just another point to emphasis, so CP in adulthood is the focus of only 4% of CP-related NIH funding, despite being 80% of the population. So what's so special about adults? Like, why do we need to make this distinction? There's a growing body of research showing that adults with CP are at higher risk for many chronic illnesses, premature aging, and at a younger age than the general population. So this is a great systematic review by Smith and her colleagues about the need for ongoing neurologic and rehabilitation care for adults with CP. So adults with CP have a 2 times greater risk of stroke, 8 times greater risk of myelopathy, which is a compression of the spinal cord that can cause weakness, bowel or bladder issues, gait difficulties in people that are ambulatory. As well as loss of mobility in at least a third, chronic fatigue in more than 65%, and chronic pain in more than 60%. And this is all compared to the general population, like adults of the same age. So we really do need specialty care for adults with CP. There are many different medical and healthcare associations that also support the importance of healthcare transition. And so here's a few: the American Academy of Family Physicians, American Academy of Pediatrics, American College of Physicians, that wrote this consensus statement on the need for healthcare transitions for young adults with special healthcare needs. And this includes recommendations that include a written transition policy that's made by 14 years of age, the creation of a portable medical summary, and other kind of milestones during the transition process. And so I'd like to poll the audience here. So how many people, and if you would like to raise your hand, you don't have to, are a person with CP or the parent or family member of a person with CP? Okay. And then keep your hands up if you or that person is over 14 years of age. And now keep your hands up if they have a written transition plan. Okay, I'm seeing some hands, which I like. And now keep it up if that was written by the time they were 14 years of age. All right, okay. So we have some, but I think you could see like hands went down pretty precipitously. And so this tracks. So there's been studies that have surveyed pediatricians and showed that only 10% that thought transition planning in general should start before age 15. And only 25% reported helping adolescents create a portable medical summary. And so this is a great resource. gottransition.org provides a lot of different transition-related resources, and I'll provide this website again at the end. And so they kind of outline these 6 core elements of transition that all take place from the time you're 14 until you've officially transitioned to adult care. And we're not going to go into details of this, but I show you this to detail and demonstrate all the different steps that are transition. And so I really don't think of transition as a step or a checkbox. It's a season of life and should be treated as such. And so what's the problem? Why, we have these recommendations. Why aren't they being instituted? What's the issue? So you can look at this from a lot of different perspectives. So from the patient or the family perspective, it's really hard to find adult providers with appropriate training. There's practice differences in the adult and pediatric models of care. It's really hard to leave a well-established relationship with someone that's known you for decades. There's decreased resources and support for young adults, and there's often a lack of guidance in the transition process. And so this is a care team map that was drawn by the parent of a child with medical complexity, kind of outlining all the people involved in their family and their child's life. And I'm sure that this resonates with a lot of people here. And I really love this map because I think it shows you why transition is so complex. It's because you're not just transitioning your pediatrician or your neurologist, you're transitioning virtually every single aspect of life. From a pediatric provider's perspective, it's really hard. There's not a lot of supported time, resources, personnel that's needed for the care coordination involved in transition. Similarly, it's hard to find adult providers. And similarly, it's really hard to give up a long-term relationship. And from the adult provider's perspective, they may not feel comfortable. They may not feel like they've had the appropriate training to manage congenital or chronic childhood conditions. It's really hard to manage psychosocial needs based on how our healthcare system is set up. Again, lack of support and resources for the care coordination that's necessary. And they may not receive an adequate transfer of information and feel overwhelmed at the prospect of having to assume care of someone that's had, an active medical history for the past 20 years. And so what we did at Colorado, I did my training there and then stayed on, so now I'm faculty there. And so as Lynn mentioned, given my area of interest, developed a transition program within our pediatric hospital, Children's Hospital Colorado, for youth with CP. And because I recognize one of the hugest barriers is finding adult providers that can provide specialty care, and because I did do clinical training in adult rehab medicine as well, I started an adults with CP clinic at our adult-based healthcare system, which is called UC Health. So I recognize I'm in a very nice position where I can transition patients to myself. which circumvents one whole area of the barriers, but you gotta start somewhere. But my long-term goal with this line of research that we're doing based in these clinics is to develop a patient and family-centered transition process from, oh gosh, this is flipped, pediatric to adult rehabilitation care for individuals with CP. And so again, this is kind of what I envision in my head as this spectrum of the season of transition. So there's transition preparation in the pediatric setting, then you're actually transitioning from pediatric to adult rehab medicine, in my case, and then overall, the goal is to improve lifespan care for adults and individuals in general with CP. And so the research we're doing right now is focusing on that actual transition process. So we're working with the young adults with CP in our clinic and their family members to identify, what do they value about their experience in our clinic, what are perceived barriers to the transition, and what might help facilitate or overcome those barriers. So our research objectives to understand the values of young adults with CP and their families, and again, those barriers and potential facilitators, and the goal is again to develop that patient and family-centered transition process. And these are our two pictures of our two hospitals there. So our Children's Hospital Colorado and then university-affiliated UC Health. So this particular project I'm going to share some information with you about was a qualitative research study. So we did interviews with individuals with CP and or their caregivers. So we offered the option to do either individual interviews or dyadic interviews where it was the adult with CP and their caregiver together. We wanted to focus on adults, so we looked at those who were 18 years and older and who were actively followed in our pediatric rehab clinic and had not yet transitioned to adult care. So we did 20 interviews, 13 with the caregiver on their own, and then 7 dyadic interviews. So we had 27 participants total. No adult with CP chose to interview on their own. And from these interviews, we identified 4 major themes, detailed here or outlined here, but I'm going to go into detail about them on the next slides. So one was really the value and security of long-term relationships. So really, and I don't think this is surprising to anybody here, these relationships are critical to not only the patient, but the family's comfort and engagement in their care. And they're really strengthened by continuity. And so the longer these patients and their families were connected with this pediatric rehab provider, the more connected they felt, the more trust they felt in the clinic team in general. And honestly, the more anxiety-provoking the transition prospect felt. And a lot of participants described their pediatric providers as family or friends and had these personal points of connection that really strengthened the relationship. And it really seemed scary to start over with new providers who might not get it. And so these slides are gonna have some quotes from the interviews from the different participants. So related to this theme, one participant said, it's like coming to see old friends or even family when they came to their clinic visits at the Children's Hospital. And another participant talked about that fear, that anxiety-provoking aspect of transition. The uncertainty makes a whole other layer of stress. There's the stress about the fact of something, and then there's the stress about not knowing how it's going to work out, right? There's this whole extra layer of fear. It's just fear. Another theme that came out of this data was that participants really felt rudderless, and that was a participant quote, navigating the logistics of transition. So they felt like they lacked the needed information to successfully transition, and they were overwhelmed by the number of changes that occur during that time period. And that makes me think of that care map I showed where, it's not just the medical that's transitioning, it's everything. And there were a lot of logistical challenges, from identifying appropriate providers, just the geography of it. In Colorado, we have patients and families that drive from the mountains and from other states, so the geography of it. Long wait times to get into new adult clinics, communication challenges, clinics that have caps on Medicaid patients. And so here are a couple more quotes. So I think that the transition, the year of 17, is truly awful. There's so many things that you have to go through as a parent that you, in some cases, are no longer considered a parent. You're considered a legal guardian. There's just so many hoops. And then another participant where we got the quote for this theme title, said, "Not only do we feel rudderless, we don't have any information. I don't know. We feel we're sort of like shooting in the dark." A third theme was, again, those differences in the pediatric and adult models of care. So it's just not the same model. So a lot of our participants expressed feeling that adult systems were unable to meet the needs of complex patients like their children compared to pediatric healthcare systems. A lot of these participants had crafted over years and decades these really great and supportive pediatric healthcare teams that they just felt really met their needs. And so the prospect of starting that process over and having to recreate the dream team was really overwhelming. And a lot of participants just didn't know where they fit best. Some felt like everything is totally fine. We would love to be seen in the Children's Hospital forever. Others felt, we don't really feel like we fit here anymore. I feel like adult issues are coming up and this just doesn't feel like the right place anymore. And some people just felt like they didn't fit in either place. And so this quote, I think, kind of gets at that. So I think that there are some adults that their bodies and stuff aren't quite the typical adult bodies. And that's it's like, where do we fit? Because adult doctors also didn't train to be treating somebody whose body is like the patient or their child. And so that's what's really scary to me. And our fourth theme was this perceived lack of provider expertise and comfort in adult care. So some participants had tried to transition to adult care or maybe transitioned some specialties or not others, and recalled challenging encounters in the adult system. So some described the deer in the headlights look, or one participant recalled an anecdote where an adult care provider told them, "I don't know what you want me to do," right? Other participants, with the prospect of seeing maybe an adult provider who had some specialty or expertise knowledge in CP and aging or adults with CP, some were excited about that potential prospect, kind of like a fresh set of eyes with someone with a different lens of expertise. And some participants identified medical training as a means to improve this. And so one of these quotes is going to speak to that. So this top quote, "She, the adult provider, knew less than we did. I'll be honest, it was concerning." Right? And then this other participant said, "As people like my child are living longer, and as you all are going through your med school training and learning more about people like my child with multidisciplined areas of medical need, you will be able to more help people like her and not have the deer in the headlights look when we walk through the door. We'll see less and less of that." And that's my big hope, is that this becomes a routine part of our medical training so that every provider feels really comfortable and capable and excited about treating patients with disabilities overall, particularly childhood onset disabilities or medical complexity. And so from these themes, we identified these facilitators or ways to help support the transition, and we divided them into 3 phases of transition that have been described previously. So transition preparation, the actual transfer of care, and then integrating into adult care. And so what came out of these interviews to prepare for transition, things that would be helpful: advanced planning and formal yet flexible transition policies, resources to assist with navigating the logistics, and information about adult providers ahead of the transition. And I think the possibility of joint visits between a pediatric and adult provider is a really great opportunity area. I recognize there are logistical and billing and time challenges to that, but I think, if they're possible, they're awesome. The transfer of care, so improved connection and communication between the healthcare systems, a pediatric provider facilitated transition, including specific recommendations for providers, and transferring during a period of medical stability. To integrate into adult care, things that came out of these interviews were the importance of the family unit, so acknowledging the expertise of parents while still acknowledging the autonomy and adultness of the patient as age and developmentally appropriate. Providers with expertise and comfort in treating adults with childhood onset disabilities, and interdisciplinary coordinated care. And so what do we need? We need a transition that's long-term, a developmental process, inclusive of all parties, flexible, supportive of emerging autonomy and adulthood, because it's a scary time, but it's an exciting time, and that's supportive of communication and education between pediatric and adult providers. And so what can you do now, right? Because we had a lot of teens and young adults represented in this room. So my challenge to you is, if your provider has not discussed transition, and this applies to not only your primary care provider, but all of your specialists, I encourage you to ask them if their clinic has a transition policy or plan. Just asking. They might not have one, but it starts the discussion, and I think acknowledging that elephant in the room is a huge first step and can honestly help alleviate a lot of the anxiety to just be talking about it and having a plan for it. Ask them if they have recommended clinics or providers in the adult system that they either know or that other patients they've transitioned have seen and recommended. And ask them about their anticipated or what their goal time frame is. A lot of this is really like clinic and specialty dependent. And if you're starting to plan the transition, I recommend involving your primary care provider. Consider staggering the transitions of different specialties. It might seem more confusing or more complicated to be transitioning different specialties at different times, but I think it can be less overwhelming to transition one thing at a time rather than having to transition everything all at once. You kind of spread out that period of, having providers that don't know you as well versus providers that do know you really well. And I think it can also help identify periods that are medically stable to transition the appropriate specialty. So let's say like seizures are super under control, haven't had a seizure in years, feel really good about that, but GI stuff is all over the place, having lots of issues. Well, maybe now's the time to transition neurology, but we wait for GI to be in a little bit better of a place. So I like the flexibility that that approach provides. Contact adult clinics well ahead of time, so don't be transitioned from the pediatric system without that appointment booked in the adult system, or at least having a near-term time frame for that. And then discuss creating a medical summary and emergency plan with your provider. So this is an example of a medical summary or an emergency care plan. I realized last night that these QR codes no longer work. I'm sorry, I think I signed up for like a free trial that expired unbeknownst to me. But I've also put the URL here. And so this includes information that you take with you to mostly emergency department visits, but really you can bring to any visit or just keep on your person. It includes information, details about like your baseline level of function, so that if you go into an emergency department and your right arm is really weak, you have this documentation that, oh no, your right arm's supposed to be strong, this is concerning, we need to work this up. It includes things like medications, school and clinic information, things that like common presenting reasons to the ED for the particular person, and oftentimes what might be going on. So maybe urinary tract infections are a big risk and they don't present in the typical way, but having this documentation of, oh, that's a red flag, and maybe that will help prompt the ED to do that workup, or the emergency department. And really, I think it's never too early to start the discussion. I think knowing what's coming, having a plan, or at least having a plan to make the plan, is a large part of the battle, and partnering with your pediatric providers is really, I think, the best way to go about it. These are a couple of those resources I mentioned. These QR codes no longer work as well, but it's Got Transition is just gottransition.org, and Family Voices, if you just Google Family Voices Transition, both of these sites have a lot of great resources about transition. We got some references there, and thank you. Thanks so much. Oh, that's not it. Okay, I'm just gonna leave it.